This is Dr. Judd Allen with Utah Valley Orthopedics and Sports Medicine with Intermountain Healthcare, presenting an arthroscopic assisted single bundle PCL reconstruction with soft tissue allograft. In my practice, surgical indications for a PCL tear include those patients with displaced bony avulsions, acute grade 3 injuries in a high-level athlete, acute grade 3 injuries with associated ligamentous injuries, and chronic grade 2 or 3 injuries with symptoms of instability and or pain. For graft preparation of a soft tissue allograft, I prefer to use the X-Wing graft board, attaching one end to the graft board and using an assistant. I use a looped suture in a running fashion through the end of the tendon. The graft is then passed through a fixed loop endobutton and reattached to the endobutton holder and secured onto the X-Wing graft table. It is then passed through the other end and secured and tensioned. If you have an all-inside ACL or other procedure where you need two buttons, this graft table works very well. A hinged knee brace is applied intraoperatively. The patient is kept on crutches for the initial 2 weeks with touchdown weight bearing. I then begin range of motion exercises at the 2-week follow-up with brace unlocked at 30 degrees and sequentially adding 30 degrees every 2 weeks to get to 90 degrees at the 6-week mark.